Welcome everyone, and thank you for joining us. From February 13th to February 17th, 2021, Texas experienced a sizable winter storm which was accompanied with significant snow and ice as well as freezing temperatures. Winter Storm Uri, as it was known, placed an incredible burden on emergency medical services due to traffic accidents, carbon monoxide poisonings, and other medical emergencies due to the loss of power and water. Emergency medical technicians and paramedics demonstrated heroic efforts to save and care for those in need. However, the nature of the storm, systemic problems, and unexpected challenges resulted in a suboptimal response. The following video examines the problems that were experienced by the emergency medical services during Winter Storm Uri. It also provides recommendations for improvements in the future. Emergency medical services, comprised of emergency medical technicians and paramedics, provide emergency medical care to those involved in accidents or affected by serious illnesses or other life-threatening situations. The goal is to stabilize the patient and get them to the hospital for additional medical treatment. In the state of Texas, EMS is very complex, with substantial variation across jurisdictions. Some communities provide EMS publicly through the government, for example, the Dallas Fire Department. Other cities and counties may have their own EMS departments, Pflugerville and Williamson. In different contexts, EMS is run through private companies, hospitals, or even nonprofit organizations, for example, Bastrop, Montgomery, and Marble Falls, respectively. Facilities, equipment, staffing, and procedures may vary dramatically in these unique contexts. While there are significant differences in the organizational arrangements and daily operations of EMS in Texas, each of these providers experienced major challenges associated with the February 2021 winter storm that blanketed the entire state. Besides having to address major demands after the pressing COVID-19 pandemic, the storm created increased loads on EMS providers and tested such agencies as they provided life-saving care. For instance, there were many traffic accidents throughout the state due to the snow and icy conditions of the roads. In Austin alone, there were over 730 accidents in a week. A major pileup in Fort Worth involved over 100 vehicles. These fender benders and major pileups in virtually all locations created a number of victims that required emergency medical care. In addition, there were many people who experienced hypothermia, and some individuals even required amputations due to frostbite due to the extremely cold temperatures. Other people could not drive to medical appointments and had medical challenges related to the lack of oxygen, the lack of medicines, or the lack of dialysis. As an example, one victim conveyed to 911 operators that my power is out, I can't get my oxygen concentrator to work, and I don't know how to use my backup tank. Another tragic experience concerned the many individuals and families that became sick or even died due to carbon monoxide poisonings as they tried to stay warm by lighting charcoal grills in their homes or sitting in a running car in the garage. According to Dr. Neil Hampson, an expert on carbon monoxide poisoning, Texas witnessed the worst carbon monoxide poisoning in history. He stated, "In their desperation, thousands of Texans unwittingly unleashed deadly gases into their homes and apartments that in many cases were not equipped with the potential life-saving carbon monoxide alarms. At least 121 deaths resulted, and more than 1,400 people required emergency medical care." The increase in workload from each of these issues was clearly visible from February 13th to February 17th, 2021. For instance, in Houston, ambulance calls were up 300%. In Austin, there were calls that included 187 environmental exposures, 115 vehicle accidents, 86 carbon monoxide exposures, and 519 falls. Call volume increased from an average of about 450 calls per day to more than 1,400 at the peak of the winter storm in February 15th. In Fort Worth, MedStar experienced twice the call volume, with 3,484 calls between February 14th and February 20th, an average of 21 calls per hour. Regarding the call volume, Matt Zavosky, an employee of MedStar Mobile Healthcare, stated, "It was certainly a record-setting week for MedStar's crews and all of our personnel." In spite of this heavy workload, EMS providers should be commended for their efforts and success in treating those in need. EMTs and paramedics worked around the clock with long hours to care for the injured and ill. In many cases, these employees and their respective organizations demonstrated creative problem solving. For instance, taking victims to a relative's house, typically a violation of policy, to limit demand on hospitals and ensure the infirm were cared for. Stoking fireplaces in nursing homes to help residents stay warm. Opening up and staffing warming centers to care for vulnerable populations, for example, the homeless. Meeting immediate needs of dialysis patients with electrolyte treatments until dialysis centers could reopen. Driving other EMTs and paramedics to work to ensure they would arrive safely. Covering the expenses associated with car accidents that employees experienced as they risked their lives to go to work. No one should question the dedication and innovative approaches of these professionals under very trying circumstances. Regardless of the heroic efforts, there were many systemic and contingency-related problems that made EMS challenging and limited the capacity to respond. Some of them related to staffing shortages and pay. Others were more relevant to the nature of this disaster and the challenges of reacting under such severe winter weather conditions. One systemic issue facing EMS is staffing. According to those working in this field, there's a lack of EMTs and paramedics. Assertions have been made that we have never fully been staffed, and that this may be a result of insufficient hourly wages. One of those interviewed for this study suggested that you can make more money at Buc-ee's being a gas station attendant. Others agreed and expressed concern that the $15 to $22 range for hourly wages is not attracting sufficient or qualified candidates. Firefighters and police officers typically make 15 to 30% more. Consequently, there are never enough personnel to meet the demands of EMS. In addition to this challenge, approximately 15% of the workforce was incapacitated due to their contraction of the COVID-19 virus. There were other challenges, however. The president of the Austin EMS Association mentioned 6 problems facing EMS providers: the loss of power to critical infrastructure, the loss of water to critical infrastructure, inability to access patients and ambulances, increased fleet accidents, lack of medical resources for vulnerable patients, for example, oxygen, dialysis, methadone, and power, hospital diversions and closures. Others agree that staffing and power integrity issues were problems and suggest that fuel shortages, communications, and information sharing was also hindered during the response. Some problems were more prevalent than others, however. The lack of power and water fell into this category. The loss of power and water had a direct impact on EMS providers. In some cases, EMTs and paramedics became victims of the disaster at home since they lacked essential utility services. The needs at their places of residence made it difficult for some employees to engage in their life-saving work because they had to care for their families. In other cases, even their EMS facility had lost power and water, which complicated operations. For example, opening garage bays, recharging batteries, cooking food, or even using the restroom. Making matters worse, the roads created situations where driving to work or driving for work became impossible or dangerous. Some employees could not get to work, so supervisors or other EMS personnel would pick up their peers. Alternatively, some EMS units rented rooms at hotels so their employees would be closer to work, thereby avoiding a commute to the station. In different cases, EMTs and paramedics slept at the EMS facilities themselves, even when power and water was not available. One employee with MedStar stated, We actually turned some of our classrooms into housing facilities, not only for our personnel but for their families. He said, "It's hard to ask first responders to come to work every day when their families are struggling with not having electricity and not having water." When responding to calls, EMS personnel also experienced difficulty driving ambulances. Ambulances got stuck and had challenges with traction. One EMT commented, "We were so close to sliding off roadways and even over guardrails on overpasses, which have resulted in our death. We often had very little control over our ambulance," another said. "Many ambulances were involved in accidents and some had to be taken out of service." Other problems that EMS providers experienced were multifaceted. EMTs and paramedics had to work long hours, spending time and energy in arduous work with limited food and water or restroom facilities. The combination of high demands and limited personnel resulted in a situation where EMTs had to work overtime. These individuals did not have nutrition and hydration at their facility and could not always find it while working in the field because fast food restaurants and convenience stores were often closed due to the loss of power, the loss of water, or the lack of employees who were unable to drive to work. In many cases, those working in EMS could not find operating restrooms. One female employee stated she had to relieve herself in a vomit bag in the back of an ambulance. Communication and direction from leaders was also lacking. EMS personnel did not receive instructions on how to handle this major disaster and did not always know when they were going to get off shift or who was coming to replace them. They felt that they were rudderless and did not always know what was going on or what should be done from a strategic perspective. One of the EMTs suggested that the blind leaders resulted in blind medics who struggled to meet the needs of victims. Others, also in a negative tone, suggested that the department stood by silently while we struggled. Regarding these very trying circumstances, one EMT revealed, "I worked 29 hours on a shift. We were sent literally all over the city, from far north to far south, back to back. We had no food, no water. We were told we couldn't use the hospital bathrooms, yet our station's bathrooms were unusable due to the lack of water. We literally had no relief. We were exhausted, run ragged, with no nutrition or basic needs to be met." To be clear, not every EMS provider went through the same challenges. Some EMTs and paramedics were able to drive to work, and others were able to safely drive on the icy roads when responding to emergency calls. Other departments were not impacted by the loss of electricity and water. Different units had sufficient supplies to stock ambulances and had additives to prevent diesel from gelling up due to the extreme winter weather. Nevertheless, Winter Storm Uri provided some important lessons for emergency medical services. The president of the Austin EMS Association provided several suggestions on how to address the problems experienced in the February 2021 storm. It was mentioned that there's a need to improve preparedness for cold weather events, improve preparedness relating to the lack of power, food, and water, increase engagement of executive staff during high-profile multi-day events, enhance communication, alter staffing, use all EMS vehicles, modify charting, modify response, treat prolonged incidents like a deployment, and acquire 4x4 ambulances. Other jurisdictions and departments conducted after-action reports and are currently making a variety of changes so the aforementioned problems can be avoided. For example, new tires and chains have been purchased for ambulances. MREs have been acquired and distributed. Blankets, hand warmers, and water are being stored. In Austin, EMS providers have been issued Yak Tracks, a slip-on rubber and metal gripping device that you can slide onto the bottom of your shoes. It makes trekking through the snow and ice a little bit easier. The storm also indicated that there needs to be more frequent communication from the department executives about changes and expectations. This event should have had several communications per day, not one per day. As noted, Winter Storm Uri posed excessive demands on emergency medical services. Traffic accidents resulted in injuries, and patients needed treatment for hypothermia and carbon monoxide poisoning. Calls increased dramatically, and EMTs and paramedics worked diligently to meet victim needs. Unfortunately, these individuals struggled to do their job due to impassable roads, the loss of utilities at home or work, insufficient food and water and restroom facilities, and limited communication from supervisors. But we can learn from this experience, avoid prior mistakes, and be in a better position to respond more effectively next time. Darren Nowak, the Deputy Public Information Officer with the Austin Travis County Emergency Medical Services, stated it best. It's always a matter of preparation. It's a matter of looking back retrospectively and seeing what worked and what didn't, and making improvements and being ready for it again. To the extent that this can be done, the problems emergency medical services encountered during Winter Storm Uri can be overcome in the future. We should remember the old adage provided by Robert Dixon: prior proper preparation prevents poor performance. Thank you.